Good evening, ladies and gentlemen. Today I will speak on the cardiac effects of radiation for the patients of cancer. This is my first presentation in Nogam. Thank you very much for giving me the time. Let us see what happens actually. What is radiation therapy? What we do? I am an oncologist and I treat cancer with radiotherapy, chemotherapy. So, first of all, what is radiotherapy? Radiotherapy is the treatment of malignant diseases with ionizing radiation. And what is ionizing radiation? Radiation is actually nothing but what we call electromagnetic wave, or in a simple way, it is the light photon, light particle, which have more energy than this common visible light. And the dose of radiation is meant by the energy absorbed inside the tumor, and this absorbed energy actually destroys the DNA structure and water molecules. So, by physical and chemical ways, the cancer cells are destroyed. Also, some normal cells in front and behind the tumor, that is also destroyed, and surrounding normal cells are destroyed. Maybe in earlier stages there was more destruction, but nowadays it is less in amount. So we found that at least 70% of the patients who require radiotherapy for their treatment, either in the definitive treatment, the curative treatment, or in the palliative setting. So actually, what happens when we treat radiotherapy, it keeps radiation or energy absorption inside the tumor, and also some surrounding tissues are affected, and that is why the normal cell suffered after a long time, or sometimes in case of very earlier stages of the disease. And in case of heart, it also happens when we give radiotherapy to the chest diseases, that is lung cancer, breast cancer, esophageal cancer, spinal cord tumors, and lymphoma in the early ages when we treat. So coronary artery disease or heart disease may be a vital factor for the patients who survive longs, and they need monitoring from the very beginning. Which have told that what is dose, but in case of heart, it happens when there is more dose, that is more than 30 gray dose is received by the heart, or per fraction dose when high for the heart. Also, there are some other factors responsible for this radiation effect or total effect when there is pre-existing cardiac disease, or when there is some use of chemotherapeutic drugs that are cardiotoxics like anthracyclines and trastuzumab, pre-existing cardiac disease, as I told. And as you know, that the radiation therapy or cancer treatment has increased the lifespan of people. So the late effects are here more. Why, we will find it later. So in 1960s, we actually knew that there is some effects, and finally we calculated or find that there is a 2% higher absolute risk of cardiac morbidity and death at 5 years, and 23% increased absolute risk after 20 years. So longer the duration, more the risk. And what happens actually, all these things are inflammatory reaction. And we know that heart cells, cardiac cells, are less sensitive to the radiation as they are permanent cells. The replicating cells are more sensitive. These are less sensitive. So there is less acute reaction than late reaction, and finally it actually is a inflammatory process, and finally there are some phenotypic change also happens later stage. We know that heart has these structures: pericardium, myocardium, endocardium, vasculatory and conduction system. We see that in case of pericardium, only acute pericarditis happens within days or weeks, but a pleural effusion, constrictive pericarditis, that may take weeks to months, even years. And the treatment is same. In case of myocardium, there also happens myocarditis, cardiomyopathy, chronic heart failure, diastolic dysfunction. It takes even weeks to months to years. And maybe myocardial disease may need heart transplantation, and it is found that the transplant patients have survived more than 48 months. In case of endocardium, yes, there it takes also years, and there are of course some phenotypic change and myofibroblast to osteoblast-like cells. So it has the treatment of valve replacement, and what we do with our cardiology friends, we treat like the same way. There's no difference. And in case of vasculatory, there may be premature coronary artery disease, ischemic heart disease, myocardial infarction, asymptomatic coronary artery disease, aortic arch calcification, carotid stenosis, transient ischemic attack, and peripheral vascular. All these you see that there are months to years time taken to happen these things, and the treatments are same as our cardiology friends do always. Also, in case of conduction system, there may be complete heart block and may need permanent pacemaker that even takes 1 to 23 years after radiotherapy. So there is a relation between the heart failure, heart disease, and cancer in a cyclic way, that chemotherapy and radiotherapy induced the specific risk factor may include all these: aging, hypertension, diabetes, obesity, alcohol, smoking. All these cofactors may lead to heart failure, and heart failure leads to some neurohormonal activation that may finally event cancer. So there is a vicious cycle. And what will be the surveillance principles? A careful baseline history, physical examination with an investigations like ECG, echocardiogram before, during treatment if needed, where required, and during follow-up, usually clinical follow-up. At the time, we also we do some CT scan where necessary, at least chest X-ray, ECG, echocardiogram at 5 years, and also a stress test at 5 to 10 years. So how can we prevent these cardiac events? We can prevent it by modern radiation therapy techniques. The radiation we must use to treat the cancer diseases. So from the very beginning of the radiotherapy treatment, that is 100 years ago, now the modern techniques has helped us to reduce the incidence to cardiac risk from 9% to 1%, and death 2% to 1%. So what are the ways to prevent? These are the basically the treatment planning systems. So we treat with patients with modernized computerized treatment planning system, and through which we can draw the target area, we calculate the dose, we verify the treatment plan, we can increase or reduce the fields, number of fields, so that we can give the maximum dose to the tumor and less dose to the surrounding normal tissues. The techniques I will show you modern techniques are 3D CRT, 3D conformal radiation therapy, image guided radiation therapy, intensity modulated radiation therapy, and VMAT, volumetric art therapy. So in the early days of radiation therapy, we did 2D planning, and there is that depends only on the chest X-ray. Later on, it came 3D and computerized based contouring and treatment planning system. Modern techniques has not only conformal, but the fluence of radiation is also maintained, also controlled or changed by this IMRT, IGRT, and latest technology is particle beam therapy, this proton therapy, and carbon ion therapy, because the photons, that is the electromagnetic wave, can pass through the body. It can give entry and exit point, some radiation dose, but the particles, that is the proton, electron, or carbon ion, they are heavier and they can not go beyond that their target area, so they will not give access to the normal surrounding tissue. So in the 2D areas you see that there are this sculpture is like this. That is not a very good picture, but in 3D some shape has come, and in IMRT you can clearly see the image of the sculpture. So for modern technique, we can see increase and monitor the dose, where the dose is more or less. Here you see that lung mediastinum is getting less dose in case of IMRT and BMAT, and this is we call it um, dose volume histogram. And by this dose volume histogram we can see our computers can calculate the dose received by the tumor area and the surrounding normal tissues. So in conclusion, we can say that we can increase the dose with this modern technique, and we need adoption of careful surveillance program in post-operative follow-up patients. We require more collaboration among the radiation oncologist, radiologist, cardiologist, national guideline, and also a new subject has arisen, the cardio-oncology. So we can conclude what with the Steve Jobs dialogue. He said that the great things are not done by one person; they are done by a team of people. So that's the conclusion, and thank you very much for invitation and patience sharing. Thank you.